What happened to Dr. Moore? The wait-and-see posture of Dionne Warwick demands a bigger conversation, and we're going to have it right now. Joining me are Dr. Cyrus, a psychiatrist here in Washington, who shared a video on Twitter about her trepidations about getting the coronavirus vaccine before getting that vaccine minutes later. Dr. Corey Hebert in New Orleans is a principal investigator for the Sanofi vaccine. And Michelle Norris, founding director of the Race Card Project, who wrote about vaccine hesitancy among Black Americans in her column at the Washington Post. Everyone, thank you very much for being here this morning for this important discussion. Dr. Hebert, let me start with you, because as a principal investigator for the Sanofi vaccine and a doctor, you are in touch with your community and talking to people. Tell us about the reaction among your patients and within your community about the vaccine. Are they afraid of it, or are they willing to avail themselves of it?
Well, it's a real dichotomy, because what has happened is that folks that are really educated are concerned that this vaccine was not developed appropriately, meaning that it was rushed. Now, the problem with this is that historically African Americans have vaccinated their children at very, very high rates, right? Children get so many vaccines from birth to 15 months of age, you can't even imagine. So this concept of you're not wanting to get a vaccine now because you feel it was rushed is steeped and based in the historical distrust of African Americans of the medical system, going from J. Marion Sims, who's the father of gynecology, who had a statue in Central Park for many, many years, but actually did reproductive harm experiments on folks that were African Americans. And so what ends up happening when that happens is that nobody wants to trust anything, but at some point you have to trust somebody. Okay. So at this point, what has happened is that this historic distrust has permeated through the entire community. But the irony is that we are the ones that are dying the most and at higher rates because of these things. I mean, right now, an African-American child that's been taken care of by a white doctor in a hospital has a bigger chance of dying. Right now, African-American women that are delivering babies in hospitals have a bigger chance of dying than in some, developing countries. So this is not something that goes as far back as the Tuskegee experiment. This is happening now. But what I have to tell you is that the trust factor is that doctors like myself, doctors like the other doctors on this panel, we have stepped up to say, you have to trust somebody sometime. And with 25 years in this business, you can trust me and people like me.
All right, well, let's go to one of those doctors. Dr. Cyrus, in your video on Twitter, you flat out say, look, I have trepidations, but I'm going to take the vaccine. And you talk about what your trepidations were. Talk about them.
Yeah, my trepidations have to do with lived experience. And I'm not even the age of Dionne Warwick or your mother. I haven't lived through those types of experiences. But I think we underappreciate the impact of the lived experience of racism and discrimination. The fact that, how many people actually look like me in a medical school class, or how many people don't ever get to see a Black psychiatrist. And so this is me at my age talking about the experiences that I've had. I consider the experiences of someone like my Aunt Mary, who, may be reluctant to have hip surgery because she doesn't trust her surgeon. She may not be able to name the Tuskegee experiments or name, J. Marion Sims, but she knows as a woman in her 70s growing up in South Carolina that she does not trust necessarily the white people who run these institutions, whether it's the medical establishment, whether it's a legal establishment. And that is something that I don't think we give enough credence to. It's that lived experience and what we're actually doing to help people feel more reassured and correct those lived experiences so they feel more confident with interacting with the medical system. And so I think at least I knew the risk of dying from coronavirus as a Black person, 2.8 times more likely than a white person. So that was my motivation in wanting to get that vaccine. But it's that education actually trickling down to the people like my Aunt Mary, right? Or just the people who are in the medical establishment like myself, or like your mother, who is a retired registered nurse. We need that education to help reassure for the present moment.
I want to play for the viewers, Dr. Cyrus, a piece of your video. Let's have a listen, and we'll talk on the other side.
Before I was a doctor, I was Black, and the medical establishment, the government, and pharmaceutical companies don't have a good track record of gaining the trust of Black people like me, or people of color in general, right? Or women, right? We can go on and on and on. But I do trust science, right? I also trust Dolly Parton, who helped to bankroll part of this vaccine. But more than that, I trust the scientists. I really want to encourage you, if you have the option to get the vaccine, trust the science.
My favorite part of that piece of the video we showed, Dr. Cyrus, is that you say, I do trust science. Impress upon viewers, particularly Black viewers, about why they should trust the science, despite what trepidations they might have.
Yeah. So I think, first of all, I like to acknowledge why people might have their fears. That's one part of having this conversation, is not to just completely disregard people's concerns.
Exactly.
I do think that there should have been more transparency around the vaccine and its development. But that's just the way that some of these trials go. It's kept, secret until it comes out and the later phases. But the science behind this vaccine, it's 94 and 95%, effective. That is phenomenal, right? And, I like to compare this to the flu vaccine, which is usually about 30% effective. And we know we still go out and get our flu vaccine. So just think of that. Of course, there's still that 5% chance. But the way that this vaccine has been developed has just been, it's remarkable in terms of the new science that they're using, the mRNA and proteins. But it's I think between the effectiveness rate, we don't know downstream some of the long-term effects, which is also a thing that maybe gave me a little bit of trepidation. But I do know that effectiveness rate is just, I keep coming back to it, because we don't see numbers that high when it comes to something like this. And so it's worth that versus that 2.8 rate of dying compared to white people. Those are the two numbers that I keep going back to. So I think in terms of the science, even if you don't fully understand it, it's worth, watching a video about it or talking to your doctor about it to understand the science from our perspective. And I think that's what we have to start doing, is having more detailed conversations that explain the science behind it and why I might feel confident about this 94 or 95% rate.
Michelle, you had a column in our paper, the Washington Post, on December 9th with the headline, "Black people are justifiably wary of vaccine. Their trust must be earned." That's what we've been talking about on this panel all along. But what was so terrific about your column is that you walk through the history and how the trepidations that Dr. Cyrus is talking about, the things that Dr. Hebert is hearing about in his community about trust. This isn't just the recent past. It's not. It goes back farther than Tuskegee. It goes all the way back to slavery.
It does. It does. And it is matched with real experience right now. It's so hard for me to see that video of Dr. Moore pleading for her life, talking about how she is mistreated. And so when Dr. Cyrus talks about the lived experience of African Americans, we need to think about the lived experience of the doctors also that are providing care. And this is an opportunity to fix a problem that was with us before the pandemic and will live long after the pandemic if we don't address and admit to racial disparities in healthcare on the whole. And so when it comes to the vaccine, a vaccine that was developed so quickly, in doing what Dr. Cyrus was talking about, explaining how the vaccine was developed, earning people's trust with information, because vaccines usually take such a long time to develop. This one was developed so quickly that people might think that corners were cut, that trials were truncated in some way. So you have to educate people. Trust has to be earned, and it has to be recognized that when people are wary of the vaccine, it is for good reason. It is reasonable. They are not, don't portray them as a community that's ignorant or uninformed about their health. They are making a reasonable decision, and you have to earn their trust. And so there has to be trusted messengers, trusted messaging, targeted messaging, and an opportunity to target distribution as well, because it would be heartbreaking if you actually earn the trust of the community and then you couldn't figure out how to get to rural communities, how to get to urban communities, how to get to places where they don't have the CVS and the Walgreens on every corner. That would be a horrible thing if that happened. And we already know that that is an impediment. And we saw that with trusting, that sort of medical equity issue where communities of color were the last in line to get